Hey everyone, welcome back to the I Believe podcast. This is another episode in our series, What's Up, Doc? And today we're featuring Miguel Materin. Welcome, Dr. Materin.
You. Thank you.
We're very excited to have you here. So, if anyone went to I Believe last year in Raleigh or watched the recordings, you will recognize Dr. Materin because he was our hosting physician. So, I'd like to just acknowledge that and thank you for that because you did an amazing job.
Thank you. Pleasure, and I hope that was informative for everyone.
I think it was. I think it was wonderful. So let's get into a little bit of backstory. So I would love it if you would just tell us a little bit about yourself, where you grew up, what your childhood was like.
So we're going really back in time, huh? So I was born in Argentina, um, and I graduated from University of Buenos Aires in Argentina. Did my training in ophthalmology in Buenos Aires as well, and did a vitro retina fellowship in Buenos Aires. Interesting when after my graduation, I would say, from the fellowship, I started to receive referrals for patients with intraocular tumors. And I remember the first patient back in 1992 was a uveal melanoma. When the second patient came, I was like, this is serious, and I wanted to train. So I came to Philadelphia for a couple of weeks, a couple of times, and was offered to do a fellowship at Wills Eye Hospital, which I did in 1999. After the fellowship, I was the first U.S. fellowship trained in my country. But the situation in Argentina was not great when we went back. My wife, our 4 kids, and I wanted to look for a different future for the family. And that's when I received the offer to work at Wills, which I did for 7 years. After that, I have I had an appointment with Yale University, where I worked for another 7 years, and then Duke came on board, and it was an opportunity for me. I got a job, and we developed, I think, a big program at Duke. And during my 10 years there, we studied a fellowship in ocular oncology at Duke. And then we hired second person, Dr. Maniar, at Duke, until recently when it was about time to be closer to our family. Now our kids are grown up, they have their families, and at least two of them are in the Northeast. So starting in April of this year, um, I came to Northwell Health, and I see where I was hired to develop an ocular oncology program here at Northwell, which is a very large health system. And I'll seeing patients in Manhattan. Soon I will start in Westchester and in Long Island. So that's the story in a nutshell.
That's amazing. So you've just relocated to New York. How's it going? Are you liking it?
Well, I had a different concept of what spring is. I thought it was warmer, but no. So far it's been great. It's nice to be close to the family, and it's nice to help in building a new program. I have um, full support, more than 100% support from the health system, and we are building our teams. We're building our teams with experienced people and physicians, and we are in the process of we just started. So far it's going well.
That's fantastic. Well, I love to hear that. When did you know that you wanted to be a doctor?
Uh, in elementary school.
Oh,
I saw myself as a doctor. I was very interested in the, to learn about the human body. But in order to be honest with you, my favorite topic was geography. But no, I know that I wanted to be a doctor um, when I was in elementary school. Then, growing up, my father was an optician, so the doctors that I know the most were ophthalmologists. And I was deciding between OBGYN, which I liked, and, and ophthalmology. But during the medical school, I realized that I really like more ophthalmology um, than OBGYN. Uh, Probably mainly because of quality of life, to be honest. At the same time, um, you may ask me why ocular oncology, and the reason was I saw that there was a need in my country, and I said that I left after being trained, but there are other people that took over. There are now at least 3 or 4 centers in Argentina that specialized in ocular tumors. But personally, I started because I saw that there was a need for that.
when did you first hear about ocular melanoma?
Um, that's very interesting because I was early in the ophthalmology career. I was training, and I remember exactly what I was doing, who I was talking to. And this was another trainee who had a friend whose father was a very well-known ophthalmologist in my country, and they were talking about ocular melanoma, and I was like, I don't think I want to go that route. And that was early in my career. And, you know, after um, getting into it, I, I saw that there was, as I said, there was a need in my country to have someone who can be specialized in that. And now, from day one, I studied, and studied. So I think I told you that um, after my first visit to Philadelphia, I went back to my country, and I had to give a presentation about my 2 weeks experience in Philadelphia. So I read, I don't know, probably 100 articles about it, and that's how I discovered that there was a need for not the need, yeah, the need in my country about ocular melanoma. And then I found out that there was a lot of unanswered questions in ocular melanoma back in the 1990s. So we have so many more answers today, and I am kind of happy that I saw the path from where we were in the late 80s and where we are now in 2026.
Yeah, it's a big jump. It's pretty cool.
The discussions were about diagnosis. We very rarely we discuss about diagnosis today. We're talking more about we have FDA approved medicines for metastatic disease. There are many clinical trials and prognosis, why every melanoma is different. So I think that we're getting closer and closer to doing better and better.
Yeah, I agree. I think that's amazing. So tell us a little bit about your location. You've just moved. What's the name of the location you're at now?
So the health system is called Northwell Health. And my appointment is with the Northwell Eye Institute, which in the past was the Manhattan Eye and Ear at Manhattan Eye and Throat Hospital. It's called Meath. Meath was built in, I think, it was in the 19th century. So there is a history in this building. But um, but when my arrangement with my agreement with Northwell was that I wanted to see more patients than in Manhattan, so that's why I will see patients also in Long Island, and I will see patients in the Westchester area. I will alternate between those two every other week, but every week here in Manhattan.
That's great. I love that. Okay. So, what do you believe makes a great doctor?
That's very, any answer that I will give, it will have definitely bias and maybe incomplete. There are some um, uh, non-negotiable topics to me. One is patient comes first, and that's the number one. Then you have different personalities within the doctors because some patients will expect bedside manners. I think that's important too. I think that's part of giving comfort to the patient in the difficult situation that the patient might be experienced. But we know that the patient is experienced, patient and the family. And then study being up to date, see all the options, interact with colleagues, um, teamwork, realizing that um, even though there is one patient, many times patients don't realize that there is a team behind the doctor or what the doctor does. So it's not about one person, it's about a team that is providing the best possible care. So, in my opinion, someone who can um, build a team that someone can work with, and a team does not mean that they need to be physicians. Team is like the person who answers the phone to schedule the appointment, the coordinators, the technicians, and the doctors, the other doctors that collaborate. So if you know, mm, you find that, you know, doctors, and I think that there are many doctors out there who are like that. And I think those are great doctors.
That's great. Now, if somebody comes to see you, what can they expect from you?
They can expect that we care about them. And everything I have just said will be in there for the patient and for the family. Patients will have a full disclosure about diagnosis, prognosis, options of treatment, and will provide best possible care for them. And we'll go with the patient through the whole challenging journey that is ahead. And then we'll try to we are all looking for the best results, and we are with the patient on that.
Aura Biosciences is a clinical stage biotechnology company focused on developing precision therapies for solid tumors that aim to preserve organ function. Our lead candidate, Belsar, is currently in late stage development for primary choroidal melanoma and in early stage development in other ocular oncology indications and bladder cancer. Our mission is to grow as an innovative global oncology company that positively transforms the lives of patients. For more information, please visit us at aurabiosciences.com.
What is your overall approach to treating ocular melanoma?
So the approach is it will depend on patient, it will depend on the tumor, depend on several factors. So if the patient needs, the most common treatment is the brachytherapy, and we offer that. We include what we believe is the best option for them to keep the eye and to keep as good vision as possible. At the same time, if there is no chance for uh, to save the eye, we will be full disclosure to the patient, telling them that we don't see that there is any chance to save the eye. So, but we will offer the biopsies. We'll explain why we do the biopsies, and we'll explain why we want to have the gene expression profile analysis and the prognostic information. So it's a long conversation with the patient, and I will give what my opinion is, and then I'll let the patient decide.
Yeah, because a lot of times there's multiple options. How do you guide them through those options?
So by talking and disclosing what the options are, and if the patient is interested in something that we don't do, well, we'll encourage the patient, go with with what you feel. And so, Megan, there is a lot of information. We have internet, now we have AI, and we have the Ocular Melanoma Foundations. All the information is in there, and NCCA guidelines. So any patient who is interested in finding information, the information is out there. We just try to, and sometimes, patients with all that information, they get lost, they don't know where they are. So we'll probably tell them where, in our opinion, they are using all that information that is available, and we'll organize those thoughts and explain why we recommend one treatment or the other.
Yeah, it's a lot of conversation and a lot of options. So I love that you explain it and walk them through it. I think that's amazing. How do you work with other specialists to provide the best care as far as like multidisciplinary teams?
So what I personally do is like we have specialty team. Let me explain that.
Okay.
So I see the patient today. The patient decided that we'll go with certain treatment. We have our internal melanoma team, and we have our tumor board. So all the patient's information goes there. We decide in terms of, okay, the patient is here, the patient was informed, this is the treatment, we discuss that, and then we prepare the patient for that. So my goal is to patient to do the less in terms of okay, where should I go? Or oh, no, I need to go. No, we try to organize their path. So this is more or less how it works. So I have an assigned person or collaborator that will be, I always joke that, okay, this person is going to be your best friend because this person is going to guide you through the process. When you're going to see radiation oncology, when you're going to have your CT scans done, when you're going to see the medical oncologist, etc. And the team already knows about it. So probably the little bit more challenging can be the radiology because that requires a special appointment. But this person, our coordinator, will explain that.
That's fantastic. That's a huge help to patients to have somebody in your corner that's like, I got you. I'm going to walk you through this and get this set up for you. That's wonderful. So let's switch gears a little bit. We're going to go a little more personal. What keeps you going on the hard days?
Well, I have kind of a personal strategy that is not unique, I think. And whenever it's a hard day, I stop, I breathe, and then I think how to go through. So, and believe it or not, I've learned that during my training days doing surgeries. When I was a trainee and there was a difficult case or there was a complication, my reaction was, okay, stop, breathe, think, and then proceed. And I would say that at all levels, personal and family or job or whatever, um, you know, that's my way of confronting or facing or handling a challenging day.
Yeah, that allows you to stop and center yourself. I think that's a great tip. You can use it anywhere, so that's a really smart thing to do. How has this work changed you as a person?
It was hard, probably more on my family, because after a long day that I see patients going through a difficult time with cancer, it's hard to hear um, the loved ones or friends or anyone, um, you know, um, uh, facing or confronting some, what I would say, it's less important in life. And that's normal. So I always tried, and I think that I've been good at that, not to bring um, anything that I saw during the day to my home. So same, you know, I'm not sure they realize, what we, um, what we do every day, and I think it's good because that creates a balance. Now, sometimes it's hard because keep thinking about the patient struggling, and personally, I keep quiet and I don't try to bring anything of those things to my home or to my friends. So that's that's another thing that I've learned how to do, after all these years.
Yeah, that makes a lot of sense. What does hope mean to you in your work?
That the patient will do well. That's say the number one, patients doing well. That's it.
Yeah. What do you love doing outside of work?
Family, sports slash gym. Um, you know, I love outdoors. So that's against of coming to New York in terms of the weather. But yeah, outside work, in the past I used to play basketball, but after the years, play a lot of tennis, or we have um, not it's not a gym, but we have different machines at home, and I like to row or indoor cycling. So, but walking is nice. And as I said, I'll spend time with the family.
That's perfect.
Yeah. Like to travel
Okay.
also.
Oh, that's
I
fun. Where
like
do
to
you like to
travel.
go?
I like everywhere, but in the past was trying to go to Argentina, and one of our daughters lives in Madrid now, so it was another reason to come to New York because it's only one flight. It's overnight, and we're there. So yeah, but I would say anywhere to find new places. I like it.
Do you have a favorite place you've been?
When we used to live in Argentina, there's a beautiful beach in Uruguay. It's called Punta del Este, and that was, I would say, my favorite place. But in recent years, I mean, we had a wedding in Patagonia, Argentina this year. It was beautiful to go there. Beautiful scenery and weather and the food, and we have family there. So, um, but I would say that I don't have one favorite, but there are different places that it's about what we do on those places and knowing those places and discovering them. So it's beautiful.
How do you unwind after a long day?
Well, that's the probably I stop again and breathe, and then I will probably go home. There is an Argentine tea that we drink. It's called mate, M-A-T-E. Um, we we found many places in the U.S. Where to get it. It's and just relax, listening to some music probably, and then you know, it could be the gym or tennis or maybe watching TV or something that nothing special, I would say.
Yeah, it's the joy in the simple things.
Yes,
Yes,
100%.
I agree.
100%.
Who has had the biggest impact on your life?
Well, I would say that um, it's not one person, but I like to say that there are a few. My father, um, my father-in-law. Um, there was a very well-known in Argentina and other places. He was the director of a place that I used to work in Argentina, Dr. Dodds, Ricardo Dodds. Um, Professionally, I would say that my time at Wheels was very important too. Um, and I cannot forget my wife. I better, because she will see this one day. I better say that but even though she doesn't hear this, yeah, um, she does too, and of course, the kids every day. But I like to learn when I hear something from someone, even if I don't know that person, and I think that, that's important. I learn from it. So, but in general, I think I name most of them.
Yeah, it's a whole team approach. I like that.
Mhm.
What does a perfect day look like for you?
Perfect day. Well, it depends if it's Monday to Friday or Saturday or Sunday.
Which one's perfect? Your choice.
My favorite day of the week is Friday. Always has been, because some work, but um, the good time is coming. But if it's at work and we did our job and patients did well, that's a good day too. So I would say that I have good days, perfect days for work and perfect days for sports. If we have a tournament in tennis and we win, that will be a great day too. The exercise, or the family. So I don't have one. I may have for each part of the different topics of my life can have a good day.
Yeah, I get that. All right, we're going into our last part of the interview. This is our lightning round. So I'm just going to pepper you with some questions and you just give me some quick answers.
Okay.
Castle Biosciences is a proud sponsor of this I Believe podcast. Castle's innovative uveal melanoma tests provide valuable information about the risk of your eye cancer spreading to help you and your healthcare team individualize the management of your disease. To learn more, visit castlebiosciences.com.
All right, so lightning round. First question: what is your go-to Starbucks order?
A small skim milk cappuccino.
Nice. Are you a morning person or a night owl?
Morning person.
What's your favorite way to spend your day off?
Playing sports.
What's your favorite vacation spot?
Well, I named one of them, Punta del Este.
You did.
Yeah, but it could be. I love going to Spain too.
Oh, nice. Okay. What is currently on your playlist for music?
Oh, for music,
Yeah.
the 80s.
Oh, love that. That's great. Okay. Favorite movie or TV show?
Well, I have several. TV show, probably Friends. I enjoy
Oh,
that.
me too.
And movie. There are several. The ones that come to my mind is what's the name I'm trying to think in English. The Death Poet Society with
Oh,
Robin
yeah.
Williams.
Yeah, Dead
That
Poet
was
Society.
that's the one. That was good. You know what? Maybe I should. Oh, about Henry with Harrison Ford. So I can tell you my favorite actors, and whenever they are in there, I probably watch the movies. Harrison Ford and Robin Williams being my favorites.
Oh, love that. That's great. Okay. Are you more of a planner or a go with the flow person?
I plan when I have to plan, and I go to the flow when I feel I can go with the flow.
I love that. That's a perfect answer, actually. Okay. What's a small thing that makes your day better?
So I would say, when, and I don't know if it's small, but never communicate anyone in my family, and again, we are a lot because it's my wife and I. We have 4 kids. We have 6 grandkids, and that's a lot of people. So, and if if I communicate with them during the day, and everything is good and fun, that's maybe simple or not, but I like that.
Perfect. I like that too. What is the best advice you've ever received?
Someone once told me, plan your life like you're going to forever, but um, live it like you're gonna die tomorrow.
I love that because it's so simple, but it's so profound at the same time. What advice would you give your younger self?
I would say, keep doing that. It is worth it.
Love that. Okay. Do you have a hidden talent?
Even to whom? To me or to someone else?
To us. To us. What is a talent you have that we don't know about?
um, I don't like to say anything, you know, because um, I am who you see, and where I think what I say, and I say what I think. So I don't think I have anything hiding. If someone
Okay.
consider talent or not talent, that's an opinion. And even if I say a talent, that would be my opinion. I can be wrong. So
That's very modest. Okay, I love it. All right. If you could instantly master a new skill, what would it be?
having a better serve in tennis.
Okay. Coffee or tea?
If the tea is mate, the one that I said before, then mate. It's the Argentine tea. But I do like good coffee.
I like it. Is there a difference between mate and yerba mate? Because I see yerba
It's
mate
the
at the
same.
store.
It's the
Same.
same.
Okay.
It's the same. It's yerba
Awesome.
mate.
Okay. Gotcha. All right. Beach or
And
mountains?
and
Oh,
and I have the mate here in my office.
nice.
Yes, so yeah.
Yeah.
So
Okay.
beach or mountain? Beach.
Beach. I love it. Last question is sweet or salty?
Both, because uh, salty when when I eat, but it has to come with something sweet afterwards.
Oh, I like that.
Yeah.
Dr. Materin, thank you so much for being here and being a guest on What's Up Doc with the I Believe podcast by Karen Sight. We were thrilled to have you. It's always a pleasure. I love your accent. I could listen to you talk all day. So I just want to thank you so much for being here.
Thank you. It's been my pleasure. Uh, this was fun. Hope people enjoy uh, getting many of us more outside of the
Yes.
professional world.
Yeah, I know. I think it's going to be a lot of fun. I can't wait till we have a playlist full of all the doctors. So this is going to be really great. If you would like to see more episodes of What's Up Doc, Please subscribe, whether you're watching on YouTube or listening on a podcast. And then leave us a comment and let us know what you thought. If you have any other questions, leave us a comment. Maybe we can send them on to Dr. Materin. And share with a friend. If somebody asks you, hey, have you ever heard of Dr. Materin? Please send them this video. That is the whole point of this series. So we really want to educate the community and share these amazing doctors with you on a professional and personal level. So please tune in next week. Please like and subscribe, and we will see you all next week.